Hello class, we are going to talk about renal system now in this video. And I will be posting my lectures on YouTube so you would be able to review them multiple times. And I hope this is an helpful study tip for all of you to re-review them multiple times. I would say connect the dots, read the book, read the PowerPoint, which I send you, and also I would say review lectures. So reviewing lectures, not only you're looking at the most important areas, but also you are actually reviewing your main important lecture. All right, so we are going to I'm going to talk about renal system. So if you have your book with you, your Amy Karch book, chapter 50. All right, so I'm going to do a screen share with you. If you have it online, pull it up online, and also you can also pull up your PowerPoints, which I send you through email. Pull them up together and try to read them as I am reviewing the lecture with you. All right, so let's do screen share here. We are going to review a little bit of anatomy from the beginning. So what are we studying? So if you notice, we are studying this chapter number 50. So this is your Amy Karch book, all right? And what are our learning objectives? We are actually reviewing anatomy of kidney, what happens, what are certain specific processes of kidney, what are the functions of kidney, key terms. Remember, always review your key terms for each chapter. Review your key terms, your PowerPoint, your basic most important underlining, and then study your study guides for your exams. Now, some of it will be repetition of what we have studied in the last lecture. So, aldosterone. Remember, what is aldosterone? It is a hormone produced by adrenal glands, and what does it do? It causes sodium water retention. All right. Antidiuretic hormone. What does it do? It also causes sodium water retention, but it is produced in the posterior pituitary gland. All right. Carbonic anhydrase. What is carbonic anhydrase? It is specific. It is a catalyst that speeds up the chemical reaction combining water and carbon dioxide. All right. Then filtration. Kidneys does the function of filtration. It filters the blood and produces urine. Okay. Next one is glomerulus. What is glomerulus? We're going to look at a picture and find out. It is actually a part of nephron, which is it is basically one cell in kidney is a nephron. And what is glomerulus? Part of that cell. Nephron, it's one cell unit of the kidney. Prostate gland, a gland present at the bottom of bladder for males. Reabsorption. What is, as the word says, reabsorption means reabsorbing things. Renin, angiotensin, aldosterone system. Remember, we have done this before, and we are going to review this part again today. Now, if you look at this, is a very, very nice picture of kidneys. Now, kidneys look like this, and they have a little crown on top of their head, and they look like this. So you see adrenal medulla, adrenal cortex sit on the top of the kidney. It has a little crown on the kidney, all right? And then you have renal capsule, you have renal cortex, you have renal medulla over here, renal sinuses, renal pelvis. Now these are two big blood vessels. They will bring blood over here to the kidneys. And what are the cells doing? They are basically filtering, making a filter and producing urine over here. And the urine goes to the ureter and goes and sits in the bladder. Through ureter, it sits in a little baggie called as urinary bladder. All right. For urinary bladder, at the bottom of urinary bladder, we have something called as prostate gland that is present for males, only for males. Now, why is it important? Because there are times when this gland will have problems and will cause urinary tract obstruction. So benign hypertrophy of prostate is a condition where when the prostate becomes hypertrophic, meaning it becomes bigger, and it causes this muscle, this little tract, to be obstructed. So that is another condition which is called benign hypertrophy of prostate, or BHP. All right, just reviewing a little bit of anatomy before we start. All right, this is a unit of, what is this? This is a unit, 1 unit of kidney. It is called nephron. Now, nephron has this is called a Bowman's capsule, a little capsule. You have 2 blood vessels coming in, the red one and the blue one is coming out, right? So efferent arteriole brings the blood in, and efferent arteriole brings the blood out, right? So the blood will go in, get filtered, and then the clean one will come out, all right? So efferent and efferent, all right? So now this Bowman capsule has a little bit of, you see this, these are called loops, distal convoluted loop, proximal convoluted loop, and there's on the bottom, there's something called as loop of Henle. Why is it important? Because some medications such as Lasix, they work on the loop for reabsorption or not allowing as much of a reabsorption of sodium water, and those are diuretics. So they're called loop diuretics because they work specifically on this portion of nephron. Okay, loop of Henle, that's the significance of it. And then there's some medication that will work on the glomerulus. Some of the medications will work on this portion. So we have different kinds of medications which will work on different portions of nephron, causing more of sodium water excretion or sodium water retention. All right, so that's one. Now, one nephron also looks like this. You know, you have little, in another way, you know, you have little capsule, you have an efferent arteriole coming in, bringing blood that is getting filtered over here. Then you have a convoluted tubule, right? And you can see over here, sodium, water, sodium, chloride, calcium, and potassium, all of that technically get absorbed over here. A lot of absorption here. It is 65% of absorption over here. And then if you look over here, right here, and you can just see this is a convoluted tubule, and then you see more of calcium, water, sodium, potassium, all of these electrolytes and water get absorbed here. And then this small little thing is called loop of Henle. And remember, medications that work on loop of Henle are called as loop diuretics. And one loop diuretic is Lasix, also called as furosemide. All right, okay. So that is another part. All right. So now so this is your book, so you can review it as you open it with me, right? Now, if you see, what are the functions of nephron? Nephron is a cell in the kidney. It causes erythropoietin release, which causes the bone marrow to increase the production of RBC, red blood cells. It will increase the oxygenation of nephron, right? So erythropoietin is something that is produced by kidneys to increase the RBC production, all right? And another part, renin, is another thing that is released in nephron, right? And what does it do? It causes activation of angiotensin 1 in lungs. Then angiotensin 1 converts to angiotensin 2. And then from angiotensin 2 converts to angiotensin 3, which causes sodium water retention, aldosterone production, sodium water retention. If you look over here, sodium water is increased. It increased retention because of aldosterone production. And if you memorize, and then also the last, basically all of it is causing more of sodium water retention, causing blood pressure to go up. Now there's medications that will cut down the system, right? So there will be medications that will be called ACE inhibitors. ACE inhibitors are angiotensin enzyme converting inhibitors that will work over here, not allowing angiotensin 1 to convert into angiotensin 2. And those are called ACE inhibitors. All enalapril, captopril, all your pills are ACE inhibitors. Now, angiotensin receptor inhibitors are called ARBs, and they work over here, right? And now the third one is medications that will, so what happens with that is not a lot of sodium water retention, and patient will not have, that will cause the blood pressure to go down. So that's how those antihypertensives work, ACE and ARBs, all right? So that's just a little bit of nutshell from this chapter, all right? Now we are going to go over PowerPoint. So we need to stop sharing, going back to our screen here. All right. So we are going back to the PowerPoint. So that was just a little review of what happens in the kidneys. What is the function of kidneys? And then I highly suggest to open your books and review the chapters as we review the PowerPoints. Okay, so let's review the PowerPoint now. What does the PowerPoint say? And that is a specific lecture has most important points for you. All right, here we go. All right, I have already sent you this PowerPoint. So kidneys, as you saw, what do? They have a strong maintenance of blood pressure through sodium water retention through renin controls, right? Influences blood pressure control. Second, it releases the renin to activate renin-angiotensin system. It leads to increased blood pressure and volume, increases the blood flow to the kidney, and it leads to the water retention and excretion, right? So major functions of renal system. What are the major functions? Why do we need our kidneys? We need them because they filter, not only make urine, but they balance our body fluid and electrolyte levels, that is maintaining hemostasis, all right? Now the second thing they do is they regulate vitamin D activation. Number 3 is they regulate blood pressure through renin-angiotensin system, all right? And the fourth part is they help in produce RBC production by producing which one? Erythropoietin. So erythropoietin, renin, blood pressure control. Those are like really good and most important functions of kidneys, right? So people who have kidney problems, they go on dialysis. After a while, their kidneys are not functioning. They do not have a lot of RBCs. They might have to go for erythropoietin shots. And they might not have enough vitamin D in their body. Their bones might be weak, because what is the function of vitamin D? To help in strengthening the bones through calcium metabolism. All right, and then they might have problems in fluid overload, because if the kidneys are not functioning, they're not producing urine, and the blood is not getting filtered, and then we have a lot of fluid and electrolytes built up in our system. So then they have to go for dialysis in order for those people to remove that extra waste of the body. Okay, so we saw in the picture from the book. These are the pictures from the book. All right, maintenance of fluid and volume, which we just talked about. And what is functions of aldosterone? What are functions of aldosterone? Influence in sodium level. Okay, influence in sodium level. It is a hormone that is produced in adrenal gland, and it is released into the circulation in response to high potassium levels. Sympathetic stimulation of angiotensin 3. It stimulates the sodium-potassium exchange pump in the cells of distal tubule. Potassium regulation. Potassium is another important electrolyte that is regulated by kidneys. Now, potassium is another cation that has a very important role in nerve cells, muscles, and specifically heart muscle. If there's a potassium irregularities, we might have something called as cardiac dysrhythmias, abnormal heart rate and rhythm. Now, about 65% of potassium that is filtered at glomerulus is reabsorbed at Bowman's capsule and the proximal convoluted tubule. And then there's a lot of sodium water retention in our different portion of nephrons, right? Vitamin D activation. So vitamin D activation, it causes vitamin D must be activated in kidneys to form that promotes calcium absorption. Once they absorb, calcium levels are maintained with very tight range of parathyroid hormones and calcitonin. So what does it mean? It means that our calcium levels in our body are maintained in a good balance by a hormone which is secreted by parathyroid gland, which sits right in the neck, okay? And those are called parathyroid hormone. Parathyroid secretes parathyroid hormone, and there's another one, calcitonin, which balances vitamin D and calcium levels in our body, okay? Functions of calcium. What is the function of calcium? Function of calcium is muscles. So muscular contraction, blood clotting, bone formation, contraction of cellular, technically muscles, but it helps with when it passes the calcium, there's channels of calcium that will go inside the cell and causes the muscular contraction, and mostly muscle movement, okay? Angiotensin system, we just reviewed it from the book. Now, functions of diuretics. Now we're going to talk about diuretics. What are different diuretics? Diuretics are the medications that will cause a man or any human being to be able to pee or urinate or make urine, right? When the kidneys are not functioning properly, we try to give them something called, as you might have heard of, Lasix, furosemide, spironolactone. Those are some diuretics. Diamox. There are different kinds of diuretics, right? So what do? They will help the kidneys to secrete sodium level. More sodium and water excretion. And what do? They will reduce the edema. If a person has a failing heart, it will help their heart to beat better because they will lose a excessive amount of fluid from the body. Acute pulmonary edema. So there's times when patient is in fluid overload and their body is full of water, and there's water that is actually retained in the lungs. It is retained in the peripheries. Sometimes there's something called as third spacing. It sits in the belly, causing ascites, condition called as ascites, and causing severe high blood pressures. So all of those are fluid overload conditions. So with fluid overload conditions, what do? There are times when we give them diuretics, right? As you see, and this is a nice picture of nephron. And this is just a little review. Now we have different kinds of diuretics. Number one is thiazide diuretics. So they are also in your book, and they are actually on page number. I'm going to review the book with you also as we review the PowerPoint. They're on page number 892. So after we review our PowerPoint, we're going to go on the book. And there's like a green table in your book. All right, which book are we talking about? Amy Karch. All right, Pharmacology, Focus in Pharmacology. This is the pharmacology lecture. All right, so thiazide and thiazide-like diuretics. What is the action of it? Action is to block the chloride pump and keep the chloride and sodium in the tubule to be excreted in urine, and thus preventing the reabsorption of both in the vascular system. So thiazide-like diuretics, what are the indications of it? For edema, any kind of fluid overload, and it is for adjunct with patients with high blood pressure. We want to reduce the blood pressure. We want to excrete extra amount of fluid from the body. It could be very well absorbed from the stomach, right? And all the medications, remember, all medications, PO medications, are metabolized in liver, and they are excreted through kidneys. We never give any person medication if they're allergic to it. So before you give any medication to a patient, always ask them, do you have any allergies to medications? So let's say you are the nurse, you go at the bedside and you say, hello sir, I brought you your chlorothiazide is one of the thiazide diuretics, and this is ordered by the physician, but before you give it to him, you're going to say, are you allergic to it? And the patient's like, no, I'm not allergic to it, but I've never taken it before. So you're going to say, okay, we're going to give it to you, but make sure that you let us know if you have any kind of odd feelings. So the patient's like, what are the odd feelings? Well, if you feel itchy, irritated, if you feel shortness of breath, difficulty breathing, those are odd feelings, which are basically technically little signs of allergies. Okay? So allergies, if a person is allergic to a medication, we never give those medications to our patients. Fluid and electrolyte imbalances. We want to make sure that their electrolytes are in balance because we are making them to pee out a lot of fluid and electrolytes. So we want to monitor those lab works before and after giving medications. And kidney and liver diseases. Okay. Cautious. We have to be real cautious with certain patients who have gout, systemic lupus disease, liver disease, hyperparathyroidism, bipolar disorder, pregnancy, lactation, diabetes, and adverse effects. What are the adverse effects? All medications, remember, all medications tend to cause GI upset. Specifically, this is the diuretic. All diuretics could cause fluid and electrolyte imbalances because they will make a person pee and urinate at that extra amount of fluid from the system. Then we are also monitoring for blood pressure. They have tendency to reduce patients' blood pressure, and they might increase patients' blood sugar levels, and we want to check all of that when we're doing these medications, right? Drug-to-drug interactions, they might be we might want to check with the physician if a patient is getting lithium, anti-diabetic agents, digoxin, cholestyramine, nursing interventions. So whenever we are giving these medications, we want to check for a patient. What are we going to check? To decrease the incidence of muscle cramps, which is frequent side effect of hydrochlorothiazide. Tell the patient to eat potassium-rich foods. All right. Okay, so before we go on loop diuretics, I'm going to go back to our main screen real quick. Okay. And then we are actually going to look at the book, because our book has some specific names. And remember, you guys were asking me about, oh, what are the names of the medications? If we could have a handout, I'm still working on it. But let me give you the pages of the book, which book has certain specific tables on them. So if you can also look over that one too. So let's look at, this is on page number 893 from the book. Okay, let me pull it up on the side. All right, we are going to go on our okay. Let us do our screen share. Thank you for giving me a minute here. Let's do screen share. So I'm going to go back to the book just to give you those tables. So, all right, here we go. So this is our next chapter, which is basically on diuretics, right? So where am I? I'm on chapter number 51 in your Karch book, okay? All right. So we are going to look at the most important points from the book. Now, this is the green table, which I was talking to you about. This talks about Diamox or acetazolamide, right? This is the first. This is another kind of diuretic, which come under carbonic anhydrase inhibitor. Another category of diuretics. This is specifically for, there's fluid that builds up in the eye. The condition is called glaucoma, right? And we give them something called as carbonic anhydrase inhibitors to reduce the amount of fluid in the eye, built up in the eye. Simple as that. That condition is called glaucoma, okay? It could be given for some, there's different kinds now, open angle glaucoma, closed angle glaucoma. And so basically eye conditions could be given for heart failure, all right? And this is the specific doses, 250 milligrams to 375 milligrams for adult patients, okay? Now, there's specific, other medications are, some of them are come under potassium-sparing diuretics. Potassium-sparing diuretics are, one of the most important one is spironolactone. Spironolactone is one of the most important one. So if you're making notes, write it down on the side. Spironolactone, 25 to 200 milligrams per day for edema. So edema is like fluid-filled situation where patients have a lot of fluid on the arms, on the legs. We give them something called as spironolactone. This is a potassium-sparing diuretic, so it will spare the potassium and allow a lot of fluid to come out of the body, but not touch potassium as much. So then we can give it for patients with having severe heart failure, liver diseases, kidney diseases, hypertension, hyperkalemia. What is hyperkalemia? High potassium levels, okay? Hyperaldosteronism. Now, during this lecture, I would say if you have any questions, let's say specific to some question came to your mind, write it down on the side, and we are going to discuss it after the session, all right? And we are going to have a question and answer session after finishing up this lecture, all right? So let's look at, so I would say write down all the most important points from the book. What are the pictures? If you have the book on the side, mark, underline, make your own notes. It's a very good habit because you can go back and forth with your notes. All right. Next one is trimethrine. Trimethrine is another potassium-sparing diuretic. You will see it quite a bit. It is used very often in clinical practice. 100 milligram per day. Specifically, why do we give? All of them pretty much are for severe edema, heart failure. Now, it is the physician's discernment which he would want to give. Osmotic diuretics are another kind of diuretics. One specific one is mannitol. Mannitol is specifically for brain. When there's a lot of fluid built up in the brain, it will pull out that extra fluid from the brain tissue. So specifically, if you look over here, treatment of elevated intracranial pressure, acute renal failure, acute glaucoma, and it is used to decrease intracranial pressure and to prevent oliguric phases of renal failure and to promote movement of toxic substance through the kidneys. All right. Now talk about the different thiazide diuretics. Over here, thiazide diuretics. What are those? They actually work on the distal convoluted tubule, which is the part of nephron. And again, it's given for edema and renal and kidney diseases. It could cause severe GI upset, CNS complications, and hypovolemia. Loop diuretics. They work on loop of Henle. Remember that little U kind of thing? That is loop of Henle. And mostly given for heart failure patient, severe edema, high blood pressure, any kind of liver and kidney disease. All right. Hypokalemia, volume depletion, hypotension, CNS effects, GI upset, and hyperglycemia. Another one is carbonic anhydrase inhibitors. They work on the proximal tubule. They just work on different portion of nephrons. But just most important ones are loop diuretics because they specifically work on the loop of Henle. Something to memorize. Carbonic anhydrase inhibitors. They are usually given for glaucoma, and one of the examples is Diamox. Potassium sparing. They work on distal and collecting ducts, and they are, if you notice, like all of them are for fluid overload conditions such as congestive heart failure, liver and kidney diseases, treatment of hypokalemia, all that good stuff. All right. Osmotic diuretic specifically for brain edema, reduction of intracranial pressure, prevention of oliguric phase of kidney failure, and so these are just specifically mentioned here. All right. So that is what I wanted to basically let you look at it, because that is a very good table in your book. All right. Now I'm going to go back on the PowerPoint and basically show you some review points from the PowerPoint. So I'm going to stop share here. Go back on the video here. We're going to go back on our PowerPoint. All right. Renal system. Okay. All right. So loop diuretics. So we're going to talk about Lasix. Lasix is a very commonly used drug. Okay. And it is a loop diuretic, most commonly used and less powerful than the new drugs. It has a larger margin of safety for home use. A lot of patients are prescribed. They go home, let's say they have mild congestive heart failure. Doctor says, okay, take your Lasix. Make sure you check your blood pressure before you take your Lasix, because this reduces the patient's blood pressure. So we always advise them, all diuretics will reduce patient's blood pressure. So we will tell them, make sure you check your blood pressure before you take your diuretic. Then another part of it is whenever they're taking diuretics, we have to give them urinal, make sure they have a urinal, or taking care of their elimination needs. We have to take care of their elimination needs. So if they can't really walk, there's times when we have patients, we have +4 edema in the bilateral lower extremities. What does that mean? Their legs are swollen, really, really big, and they can't really walk as much. So there's times when we can offer them bedpans. We can order bedside commodes if they can get up and sit on a commode at the bedside, because once you give them diuretic, they will be peeing on you. So you have to make sure that you give them all kind of things which if they are incontinent. There's times when we put them on diaper. And intake and output, we have to measure what's going on, what's going in, and what's coming out. So intake and output measurement, all right? Okay, so Lasix. Actions are to block the chloride pump at the ascending loop of Henle and causes reabsorption of sodium and chloride. Indications. What is an indication? Why would I give a diuretic to my patient when a patient has fluid overload condition, when they have severe edema, their heart's not functioning very well? We want to reduce the amount of load on the heart, and then we want to, what do we want to do? We also reduce the amount of blood pressure, right? Diuretics. We want to make sure that we are not giving any medication to our patients if they're having allergies. That is a severe contraindications. Remember that part. All the medications that are functioning on the kidneys, if they're non-functional kidneys, we want to make sure that we check the kidney function test before we start giving them those medications. What comes under kidney function test? BUN, blood urea nitrogen, and creatinine. So we will check those lab works, all right? We also check their liver function. We want to make sure that they're not pregnant or lactating, right? Loop diuretics. Loop diuretics also, remember that they have really bad adverse effects. They could cause severe fluid volume imbalances. They could cause hypokalemia. Their potassium levels might go low. They might cause alkalosis and hypocalcemia, all right? So those are all loop diuretics. Next is potassium-sparing diuretics. Potassium-sparing diuretics, what are those? Remember, spironolactone is one of the most important one to remember it. Another one is triametrine and amiloride. Those are just few names. All right, what's the function? They are all diuretics, but they spare the potassium. And where do they work on? They work on the distal tubule, all right? Indication, why would I give it? I would give it when a person has severe high blood pressure, fluid overload. Those are the indications. When would I not give it? When a patient has allergy. Also want to check on the potassium levels because this is a potassium sparing diuretic. We want to make sure that their K levels or potassium levels are in the normal range. What is the normal range of potassium? It is approximately 3.5 to 5 milliequivalents per liter, right? Okay, adverse effect. It could cause what adverse effect it could cause? It could cause hyperkalemia. Potassium levels could go up with these medications. So we monitor potassium levels and we don't encourage them to eat high potassium foods. All right. Urinary tract infections. Chapter 52. Next. How many times people have urinary tract infections? Many, many times. Now, for urinary tract infections, what are the signs and symptoms? If someone has an infection in their urinary tract, what would be the sign? Sign would be a smelly urine. Like, oh, my urine is smelly or stinky. What's going on? Oh, there might be an infection. All right. Urinary frequency. They might have to go to the bathroom multiple times. Urgency. Oh, I have to go pee. Oh my God. Every 5 minutes or 10 minutes, that's a sign of infection. Burning on your urination. So they're like, oh, feeling like, oh, it's burning. Like, what's going on? Because, well, I might have infection. Other signs of infection are, other signs of urinary tract infections are chills, fever, flank pain, tenderness associated with acute pyelonephritis. What is pyelonephritis? It's a fancy word for infections in kidneys, okay? And cystitis, another fancy word or medical terminology for infection in the bladder, right? How would I treat infection? Antibiotics. We would give them antibiotics to clear the urinary tract, right? And drugs that will not allow the urinary muscles to be cramping so much, because when a person has infection, it irritates the bladder muscle and it would cramp. So we give them something called as urinary tract antispasmodics. Also give them something to relieve that pain and irritation, all right? And if it's a male patient and they have enlarged prostate, sometimes we have to make sure that if they have any kind of benign hypertrophic prostate, that has to be treated separately, right? Okay, urinary tract antispasmodics are some medications which we give to reduce the urinary tract spasms. One of the medications is oxybutynin, all right? We're going to look in the book and look at the table which it has, and talks about different kinds of antispasmodics, which we're going to go in a little bit in a few minutes. Okay, I think it's on page number 909, all right? 909. But let's review our PowerPoint first. All right. So going back, urinary tract antispasmodics, right? So antispasmodics, they will reduce the amount of spasm, reduce the amount of pain, all right, and dysuria, which is painful urination. Urinary tract antispasmodics. What are urinary tract antispasmodics? They could cause. Basically, we want to make sure that whenever we are giving any medication, do not give them if they have severe allergies. Also, we want to make sure that if they have any other disorders such as glaucoma, myasthenia gravis, and acute hemorrhage, we have to make sure that those medications should not be given in those conditions. Cautious. Always check your kidney function test and renal function test before giving any medication, because all medications are metabolized by liver and excreted by kidneys. All right, and if a person's pregnant or lactating, we always check with the physician and let them know, because some medications are like a no at that time. So we will call the doctor like, hey, you know what, this person told me they're pregnant and you ordered an antispasmodic, what do you think? And just double check. All right, don't just give it, but just double check if they're pregnant. So that's caution area. Assess means check whether patient has so we talk about pregnancy, lactation, any kind of eye problems such as glaucoma. What is glaucoma? There's water in your eyeballs and it becomes really for the first time. All right, so all right, okay, so let's go we're gonna go back to our PowerPoint. All right, just a little in-home interruption here.
Sorry.
Okay, that's okay. All right, so going back to our urinary tract antispasmodics. So urinary tract antispasmodics we give. Why do we give them? We want to make sure that whenever a patient has urinary tract infections, their bladder is not causing a lot of spasm and it causes a lot of pain and it reduces the amount of pain. So one of those medications is oxybutynin, right? Oxybutynin, and you see prototype oxybutynin, and it is given for relief of symptoms of bladder instability associated with neurogenic bladder or reflex neurogenic bladder spasms. Any kind of bladder spasms, we give them this medications. So they come under urinary tract antispasmodics. Analgesia, there's times when the patient's burning, they're having frequency, and then they say, oh, you know what, I'm having burning micturition, what do I do? So we give them something called as that will cause the pain to go down, and the name of the medication is phenoxyparidine. So it's also called as pyridium. One of the trade names for this medication is pyridium. It is a dye. It will color the urine orange. So there's times when they're peeing and the urine turns orange, and they're like, why is my urine turning orange? Well, if you're taking phenopyridine, that's just a normal occurrence. Okay. Indications. Why would we give it? When a person has urinary tract irritations from infections. All right, because they cause urinary tract analgesia. When do you never give that? If a person have allergies, be cautious when patients are pregnant or lactating. And adverse side effects. What are the side effects related with it? GI upset, headache, rash, reddish orange coloring, and renal and hepatic toxicity, drug-to-drug interactions. Okay. The last one is treatment of benign hypertrophy prostate. What is treatment of benign hypertrophy? What is this condition called as hypertrophy of prostate? Remember, enlargement of the gland that surrounds the urethra in the males, only in males, for discomfort, and sometimes this gland becomes big and it causes that urinary tract, it squeezes that urinary tract, and it does not allow as much. Patient feels like they cannot go pee, they cannot initiate urine, and that is difficulty urination basically in males. Now the medications we give to reduce the size of prostate, there are two types. One is alpha adrenergic blockers, right? So some of the names are tamsulosin, doxazosin, right? Alphazocin. Then trazocin, all right? And drugs that block testosterone production are finasteride and Avodart, also called as dutasteride. Wow, amazing names. All right. Drugs for treatment of benign hypertrophy of prostate. All right. So what are their actions? They will actually treat that hypertrophy. They might reduce the amount of cell. And then what cautions we have to take? We want to make sure that kidney functions and renal functions are normal. Adverse side effects: it could cause headache, fatigue, dizziness, postural dizziness, lethargy, tachycardia, high heart rate, hypotension, and GI upset. It could also cause decreased libido, impotence, and sexual dysfunction. Right? Now here's an example of doxycycline. You can review this. And then this kind of contributes our PowerPoint, but on the other hand, if we go back to the book, I would definitely want to review the book with you before we end this lecture. I'm just going to tell you what the book says and just add on points. Now with this video recorded lecture, I highly recommend that you write down your questions on the side. You can email me those questions. You can we're going to do a Wednesday 6 p.m. session pretty much every Wednesday. You can bring up your questions, queries. That will be our extra tutoring area, like 6 to 7. We can do 6 to 9, whatever time you need. Plus, this is a recorded lecture. You can play it multiple times, and I hope this is helpful, okay? And anything else we're going to discuss later on. So let's look at our book. What does the book say? It's always a good idea to review your book side by side. Okay. Here we are. All right. This is your book over here. What does it say? So now we are going to, this was the chapter for diuretics. We are going to go on chapter 4. Drugs for urinary tract and bladder, which is chapter number 52. We're going to go chapter number 52. Here's your renal system. 52, right? So we're going to start from the beginning. Go back here. All right, so urinary tract anti-infectives. Okay, let's see, let's go back up. Okay, so this is chapter number 52. All right, you guys, so this is chapter 52. This is drugs to treat urinary tract infections in the bladder. All right, so what are those medications? So there's a list over here right in the very beginning. You can review it by yourself later on. I'm going to just review the most important parts, okay? Let's see. For some reason, I feel like this font is a little bit too big, but that's fine. Urinary tract infections could be, they could be treated, right, by antibiotics and some antispasmodics. Antibiotics for urinary tract infections they're listed over here: trimethoprim, nitrofurantoin, methylene blue. These are just some urinary tract anti-infectives, right? They wash off the infection. Now, because of the infection, there's like spasms in the belly. Like when a person has infection, they're like, oh, I have pain in my abdomen. Why? Because it causes spasm. And for reducing the amount of urinary tract spasms, we give them medication called as oxybutynin. Oxybutynin, all right? Pain medication, some pain medication are phenylpyridine. Remember, it turns the urine orange, pyridium, okay? But it also relieves the pain in the urinary tract. For benign hypertrophy of prostate, to reduce the size of prostate, what are the medications we give? Doxycycline, tamsulosin, terazosin, alfusin, and testosterone inhibitors are finasteride and dutasteride. All right? Okay, all of those. Perfect. Next, all right. So this one talks about, what does it say? If I'm going to give my patient so I don't know whether you know this, like if you have ever used this or you've administered this some kind of medication for urinary tract infections are very, very common for our patients and patient population. So macrobid is very commonly used medication for UTI, 50 to 100 milligrams for adult population. Then trimethoprim is 100 milligrams, treatment for UTI. Trimethoprim and sulfamethoxazole is 160 milligrams, all right? Or 160 milligram over 800 milligrams. So this is trimethoprim is 160 and sulfamethoxazole is 800 milligrams. So they come, a person can take it every 12 hours, depending on what the physician orders. All right. So here's a nice picture of a male urinary tract system. So this is for urinary tract analgesia. Some medication that will reduce the amount of spasm in this muscle, because your bladder is technically a muscle outside, right? Now this is the prostate gland that could enlarge at times, and we want to reduce the size, and that's when we give them alpha blockers to treat benign hypertrophy of prostate. We could also give them testosterone blockers that also treat benign hypertrophy prostate. All right. So pictures sometimes help you kind of visualize. Visual aids also help you. You can also look them up by yourself. Just going to give you the most important points in this lecture. Another part. Now this little picture also talks. What does it talk about? Wow. Let's look at. This is adverse effects of what kind of medication, it doesn't say. All right, let's see. Adverse effects associated include, let's see, what medication? Oh, one of the most important point I want to tell you is about urinary tract infections. It's a very, very good chance we can give them cranberry juice. Cranberry juice is something which always all physicians will advise to all patients that cranberry juice flushes out infection. It kills the bacteria. So this is the little point over here, box 52.2 in your book talks about how cranberry juice is very good for UTI patients. And something called acid ash diet. What is an acid ash diet? When we acidify urine, we give them more meats, and fresh fruits and fresh vegetables are high on the acidify urine, and also cranberries also. So something that is dietary treatment. We also tell them to drink lots and lots of water to flush the infection out. All right. So that is our dietary management for urinary tract infections. Also for patient education, if they are having urinary tract infections, we want to tell them avoid bubble baths, avoid going to regular swimming pools and jacuzzis that also when people use it all together, like let's say you go in, let's say in your complex where you live, you have a pool where everybody uses it, a very high chance of getting UTI. If people sit in the same jacuzzi, very, very high chance of getting UTI. So those are reservoirs of infection sometimes. Even though sometimes they put the bleach in, but people could get infections, urinary tract infections from using the same pool, swimming pools, jacuzzis. So we tell them avoid bubble bath, try not to go over there. And then sexual hygiene is another important part of urinary tract infections. We want to make sure that we inform our patients to maintain a good sexual hygiene, which is basically cleaning private parts before and after the intercourse with soap and water, right? So that is basically this is basically patient teaching related to urinary tract infections. All right, so we talked about cranberry juice, and you can review the rest of the part of the book. I think I just want to make sure that we're not missing any points before we end this lecture. Just want to review the book with you. Okay, there's the table over here. I always love to look at the tables for some reason. It kind of gives me, like, whenever I'm reviewing my book or making my notes, I would just definitely look at my tables because they are very specific important points hidden in them. So it's a good thing to review just point by point description. All right. So urinary tract antispasmodics. So you have Enablex. All right. Then you have flavoxate. You have oxybutynin. Oxybutynin is very commonly used medication. Another one. They're all antispasmodics treatment for overactive bladder. You see, relief of bladder spasms, right? All that good stuff. All right, Detrol LA is another common one to memorize. Okay, and then the last one, pretty much almost done. Just want to make sure that we are finishing up. Now, phenazopyridine. Phenazopyridine is a very important urinary tract analgesic. Why do we give it? Because it reduces the irritation in the urine. It's a relief of discomfort, right? Relief of the discomforts associated with urinary tract trauma infections. And it will cause the urine to turn into orange. Remember that part. Orange color urine is related with pyridium or phenylpyridine. All right. Okay. That is specific with our pyridium. The last part of it is treatment of benign hypertrophy prostate, which is this. I think this is the last table before we could just say thank you so much, right? So let's look at this one. So it talks about alphazocin, doxazocin. Tamsulosin is a very, very commonly used medication, which is also called as Flomax. This Cardura is also a very commonly used medication. Doxazocin, you'll probably give it to, you'll be like, oh, your physician orders it to a patient. It's like Tamsulosin, 0.4 milligrams per day. And you're like, oh, why am I giving Tamsulosin? Let me look it up. And you're like, oh, that's for benign hypertrophy prostate. All right? Remember this. If you don't memorize, oh, I don't memorize. I have read it, but I just can't memorize. What medication was this? You can always look it up on your phone. Just go on Google and just put the name of the medication, and I'll give you a little description of it. What is the function of it? What does it do? And whenever you're giving medication to a patient, it's always a good idea to just review what are the actions and most important side effects related with that medication before you administer that medication. Now, before administering any medication, always check whether a patient is allergic to that medication. Have they ever taken it before? Why are you giving that medication? And your nursing management should be, after 1 hour, I will check 1 to 2 hours. What is it functioning properly? Is it not functioning properly? So if I'm giving patient a diuretic, I would want to see if patient's peeing a lot, right? They would end up urinating a lot. If I'm giving them antispasmodic, their pain should be relieved. If I'm giving them pyridium, which is urinary tract analgesic, it must relieve their pain in their bladder, right? Then if I'm giving them benign hypertrophy prostate medications, such as tamsulosin, they should be able to urinate better because it will relieve that urinary hesitancy, and they would be able to urinate better after this medication. All right. Okay. So that's, I think that's just the last part of this. And then there's some questions at the end of the chapter. So I'm going to do stop share here. I'm going back on the main video. All right. I hope, I think I have covered everything pretty much from your PowerPoint, your book. I highly recommend whenever you're studying to review your PowerPoint, your book together, match all the points, make your own notes, because your notes are forever. You can use them, let's say 10 years from now, you're an educator, or who knows, you're a nurse practitioner, God knows where you're going to be. But they are something you look back to, and you always refer to them. I have my notes from my nursing school on pharm, and believe me, I still look at them, and that's quite a while ago, But on the other hand, they're very helpful because they're like specific, the most important things which I want to study, and there are times when I just have to review some medications really quick, and I just go back to them. It's extremely helpful. All right, so I highly encourage you to make your own notes, even when you're watching a video and listening to video. Make your own notes. Write down the most important points, names of the medications, write them multiple times, like write it down, read it again 2 to 3 times, practice, and that will help you memorize them. All right. those are some study tips, and we are going to do question and answer session. And thank you for listening. And this is the end of this video, and we're going to definitely we're going to talk about some reviewing of the video. Is it helpful or not? That is something which I would want to ask you, and that's pretty much it. All right, okay, we will catch up on Zoom later. Thank you.